Our guest is Dr. Isabelle Bedrosian. She is with the MD Anderson Cancer Center. Doctor, welcome to the show.
Good afternoon. Thank you.
Let's tell people, first of all, your role at MD Anderson as far as breast cancer goes. Let's tell people what you do there.
Sure. So I am a surgical oncologist, and the practice of my practice focus is breast cancer. So essentially, I do surgery on patients with operable breast cancer.
And certainly here we are today on this special show of Real Estate Matters with Stewart title, trying to help the Nancy Owens Breast Cancer Foundation. I want to tell people right up front, the website is nancyowens.org. Let's tell people your relationship to this foundation.
Sure. So I am fortunate to have my research supported by the Nancy Owens Foundation. They have been supporting our efforts at MD Anderson for some years now, and I'm very excited to be able to share some of the research that we've done with the support of those funds.
Let's tell people some of the advances perhaps that have been, let's just say in the last year, even though it's been a crazy year, I'm sure there have been some advances. What are some of the things we should know about there?
Sure. I think a lot of advances have come in the area of treatment of breast cancer. So, we have made progress in terms of immune-based therapies for breast cancer, in some advanced targeted therapies for breast cancer. So we actually have been seeing some promising new drugs that have come so far, are going to make some substantial difference for advanced breast cancer patients. And hopefully, over the coming years, some of these agents will also be proven effective in the earlier stages of disease as well.
And I would think, like anything, we think about early diagnosis, the earlier the better in terms of treatment.
Oh, for sure. There are several advantages to early diagnosis, early detection and diagnosis. The first is that the earlier you catch the disease, the more likely you are to be able to cure that patient. And the second is that the earlier you catch the disease, the more likely you are to not need as extensive and aggressive treatment for that disease. So very important to have early detection and early diagnosis.
From a prevention standpoint, what should people do? Mostly women. I know breast cancer also affects some men in
Right.
I suppose, a limited basis. But as far as women go, what should they do every year in terms of prevention and checking themselves? Or what are the warning signs when they should see a doctor?
Right. So I think there's a number of important factors women should consider. I think maintaining good overall health is very important for many things, many diseases, including breast cancer. So maintaining healthy body weight, exercising are all things that one can do to try to reduce one's risk. I think the other critical part is to know your family history. A substantial number of women are at risk because of their family history. So really understanding what your family history looks like, seeking out the services of high-risk clinics if you do have a family history of breast cancer or even ovarian cancer, because we do see, or any type of cancer. Honestly, I would encourage women to seek advice from a health provider, whether the clustering of cancers in that family indicates potentially a high-risk situation. And if so, they can be tested for what we call germline mutations, things like BRCA1, BRCA2. I'm sure these are genes that many listeners may be familiar with. This is what Angelina Jolie most famously was diagnosed with. And so these genes can explain some of the cancers that run in families. And if we can identify families who are at risk, identify the genes that cause them, then we can actually offer women intensified screening so that we can really improve early detection and diagnosis in those high-risk populations.
Taking three categories: prevention, treatment, and research.
Right.
Which one of those categories are you in most of the time?
Right. So I obviously have an active practice, and I treat breast cancer patients. On the research side, my research is focused on the ideas of early detection and on prevention. And the prevention area in particular, our program is focused on developing vaccines for breast cancer prevention. This was work actually started by my colleague Beth Mittendorf, who left to go to Boston, but we do still collaborate. When she started this program, the effort was really on developing vaccines for a type of breast cancer called HER2-positive breast cancer. We've had a number of studies using this HER2-directed vaccine, and we are currently waiting the results of some of those studies. But it occurred to us, though, that even if this HER2 vaccine is successful, it's only going to go so far, because HER2-positive breast cancer accounts for only about 20% of breast cancers. So about 80% of women are not going to get HER2-positive breast cancer, and so there would be no benefit to them at all to give them this HER2-directed vaccine. So we started to think about how can we broaden the vaccine opportunities. for breast cancer treatment and breast cancer prevention, because we are hopeful that we can take some of these vaccines and move them into the true prevention arena, not just for the treatment of disease, but the prevention of disease. So we have been actively investigating and trying to develop additional vaccines targeting things other than HER2, because we feel that we are going to need a multitude of vaccines to treat the various different types of breast cancer that women are prone to get.
And so when we think about research, when people go to nancyowens.org and make donations, those kind of donations go to help the kind of research you're talking about, it sounds like.
Yes, that's correct. And actually that's huge, because, when we're first starting to develop a line of investigation, it's really hit or miss. You have certain ideas, you try them out, sometimes they work, sometimes they don't. Most funding organizations in this country aren't really going to fund hit or miss research. They really want something that has a pretty good chance of succeeding. And so getting pilot funds from Nancy Owen really allows us to do these initial hit or miss, to develop some ideas and lines of investigation that we can say, hey, this is helpful, this is working. It gives us what we call pilot data, preliminary data, and we can then use those data to help make the case for larger funded studies through organizations such as the NCI.
And again, thinking in terms of the prevention aspect, there are vaccines in the works, medicines that are out there, I suppose. But also, what about just nutrition? Are there certain things that you may stay away from as far as food goes that you've found that might lean more towards cancer, or just general nutrition? What are some do's and don'ts that you might practice in your life?
Yeah, so, I think I get that question a lot from my patients. What do I avoid? What should I eat? There really is not a breast cancer diet. Your basic facts of nutrition that you've heard over and over again about eating a fiber-rich diet, reduce your intake of, red meat, really holds for breast cancer. So there are no specific foods that I would say avoid for purposes of breast cancer. I would just say maintain a healthy diet with as much plant-based as you can get, reducing your intake of red meats. In terms of alcohol, because that's another one, maintain sort of limited alcohol intake. If you don't drink, don't start drinking. But if you do drink, moderation is the key. Obviously, smoking, please do. If you are a smoker, please,
Please
engage
stop.
with. Well, engage. I realize it's difficult. I mean, it's very difficult to stop, addictive habits like smoking. So, but there are resources out there. Engage with them. See if you can get off of the smoking as well. So, I think the answer there is maintaining an overall healthy lifestyle is going to help you in a multitude of ways, including potentially reducing your risk of breast cancer.
Well, one more thing along that same line. And what about vitamins? Is it good to take a multiple vitamin? Can it hurt? What about extra vitamin C, vitamin D for the immune system?
Yeah, so, I would say that in general, if you're eating a well-balanced, healthy diet, supplemental vitamins are not needed. I would say that some exceptions to that are women who are older, who may have some bone softening of the bones. They may need some supplemental calcium and vitamin D, for example, but those should always be done under the guidance of a physician. I wouldn't really recommend taking things off the shelf, particularly outside the general vitamin arena. A lot of the supplements that people might see at nutrition stores could have deleterious effects, and it would be important, if you were to take those, to take them with the advice of a physician. And I should also note that none of these supplements really have been shown to affect breast cancer risk. So taking them isn't going to change in any way your risk of getting breast cancer.
What is the first thing that a woman would notice where they would go to a doctor to say, hey, I think something's not right?
Well, hopefully they won't notice anything, because, with the use of screening mammography, a lot of women are completely what we call asymptomatic. They have no symptoms, and oftentimes they're surprised that they have breast cancer. But that's actually exactly how we want to find it. We want to find it before you actually have symptoms. So screening mammography, usually done on an annual basis, means that most women who have breast cancer don't have symptoms at all. But some symptoms that should they occur, I would say the following need immediate attention. A lump in the breast should always get attention. I would say that changes in the color of the skin, swelling of the breast, nipple discharge, those are all things that should get immediate attention and should be evaluated appropriately by the physicians.
So with, let's say, the last 2 minutes or so, what are some of the other things that are important for people to hear in what you're doing, and how possibly they can prevent, or if they have breast cancer, maybe some good news as far as the treatment and the success rates?
Yeah, I mean, I think increasingly with every passing year, we're seeing more and more drugs come online that are going to be helpful towards treating breast cancer and curing more women. I think, to me, the one of the most exciting areas that I see being developed, including by our own research group, is changing this idea of early detection and changing it from identification of disease on the mammogram, and instead moving the timeline and saying, instead of identifying the disease in 2020, could we have known in 2019 that that disease was about to happen? And so this idea of predicting who's at risk of breast cancer within the next year or two, before they actually even have the disease, and allowing us to intervene to reduce the risk and reduce that cancer from even happening in the first place. And that is a very, very exciting area in research right now, and it's being driven by artificial intelligence and computing. And so I'm very optimistic that in the coming years, we're going to really shift the bar for early detection to actually identifying women who are about to go on to get breast cancer, intervening so that they actually never even experience a diagnosis.
We're talking with Dr. Isabelle Bedrosian, doctor of all the fields of medicine that you could be in. How is it that you chose this one for your life's work?
So I chose to go into surgery because I really loved the idea of, using my hands and using hand-based skills. I love the concepts in surgery. I love the connections with patients in surgery. So I went into general surgery for those reasons. And then I enjoy taking care of cancer patients. So I came down to MD Anderson to do a fellowship in cancer surgery. And while I was there, I found that I really enjoyed working with breast cancer patients. And so here I am, 15 years on, really enjoying taking care of breast cancer patients and hopeful that we will continue to make progress in treating the disease, and to me, most excitingly, in preventing the disease, so that we can further reduce, the cost of this illness on women in this country.
And we want to remind people you can go to nancyowens.org to make a donation to find out more information about the Nancy Owens Breast Cancer Foundation. And doctor, are there any websites where they can learn more about prevention, or at MD Anderson?
Yeah, there's actually MD Anderson has an entire prevention department, so I would encourage them to look at the website at MD Anderson for further advice and information about prevention of cancer in general and breast cancer in particular.
Thank you so much for being on the show.
Thank you so much. Great to be here.